Hello friends, so again here I am with a new topic, that is the memory based questions of the NEET PG 2021 part 3. I already mentioned the two parts before. So the question 1 of the part 3 is case of the measles. Case of measles, the type of virus involved. Which type of virus involved in case of measles? So it is the single stranded RNA. Single stranded RNA, helical in nature. Second question, outbreak of the buboes in community, the vector is, so Xenophilus eupis, that is the red flea. Answer is Xenophilus eupis, red flea. Question 3, fever in UP with organism with kinetoplast in macrophages. So the cause is leishmaniasis. Answer is leishmaniasis. Now question 4, mismatch repair defect is. Answer is HNPCC, that is hereditary non-polyposis colorectal cancer. Yes, with all possible options, this is the best answer in which mismatch repair defect is seen. Now question 5, black urine, alkaptonuria, the enzyme responsible for it is. So three options which I got from remembrance, that is FAH, 4-HPPD and homogenetic acid dehydrogenase. So this is the answer, homogenetic dehydrogenase. Now the question 6, patient had dinner at 8 p.m. He does blood sugar at 7 a.m. So the major source of glucose is liver glycogen. Answer is liver glycogen. Next question 7 is patient with tendon xanthomas increase LDL and cholesterol. So the answer is type 2 hyperchylomicromia. Type 2 hyperchylomicromia. Question 8 is a female adult present a female adult patient presents with wrist joint swelling which is in the epiphyseal region of the wrist. So the answer is, I just try to draw this type of diagram which is not so good, but just I want to draw the attention that it is eccentric in location. It is eccentric in location. So the answer is GCC, that is giant cell tumor, osteoclastoma. Next question, great saphenous vein graft was used in CABG. Following operation, the patient is having the loss of sensation from the medial aspect of the thigh and legs. So the which nerve is damaged? There are four options, sural nerve, anterior tibial nerve, deep peroneal nerve, but the answer is saphenous nerve. If you go in the detail, then you will find the saphenous nerve is the best answer for this. Next question, 11-year-old boy having symptoms of fever, sore throat. To diagnose the condition, throat swab is taken. After collection of the swab, it is discarded in which type of bag? According to the waste management, then it is the yellow bag. If you clearly read the literature, you find the best answer is the yellow bag. Next question, 7-year-old child having complaint in leg during the walking, x-ray is shown which shows the, if you remember that x-ray, that will clearly show the white line Frankel Trummerfield zone, Wimberg sign, which clearly shows the case of scurvy. So the answer is scurvy. Next, metrogel is indicated for various anaerobic infection. After prescribing the metronidazole, you will warn the patient about which drug, substance for stopping that side effect. So the alcohol is the answer, as metronidazole cause the disulfiram like reaction. Next question, a woman is presented to ENT OPD with complaint of the nasal obstruction. On examination, greenish black crust seen in nasal cavity covering the turbinates and septum. Covering the turbinates and septum. Superficial anosmia is also present. What other sign you will find? So, roomy nasal cavity. That means that woman must have the atrophic rhinitis, because these all are the feature of the atrophic rhinitis. Roomy nasal cavity and greenish black crust seen in the nasal cavity in covering turbinates and septum, these all indicate the atrophic rhinitis. So the best possible option is roomy nasal cavity. Next question. 35 years old male presents with epistaxis. Conservative management was done to stop the bleeding, but it failed. So what will be the next step of the management? So the step of the management is TES-PES, that is the artery of epistaxis ligation. This is the best possible management we can done in all the possible options. Now I just try to draw some image showing this a marbling in the legs. This photos this photo is just a part of the remembrance. So it occurs due to deposition of the sulfate hemoglobin. So this is the best possible answer. Thank you, and be updated with me. I After some time I will launch the part 4 and you will get some more questions. If you have any doubt, please post me in the comment box. Thank you.